All right, welcome back everyone. So what we're going to look at in this part is we're going to primarily focus here on this graph, right? So what this graph is, it looks scary. It looks like there's a lot of moving parts and a lot of things, and there is, but we'll break it down. So I want you to focus primarily on the four graphs where I have the four red arrows, right? So focus on the electrocardiogram, your aortic pressure, left ventricular pressure, and left ventricular volume, right? So first off, I want you to look at the P wave, right? So I want you to look at the P wave up here at our electrocardiogram, right? So P wave indicates what, right? The P wave represents our atrial depolarization, right? Atrial depolarization is our atrial contraction, right? So you can look down here at left atrial pressure. Whenever you begin to have the P wave, you begin to have a slight increase in pressure, right? And then it drops when it relaxes. Look next at the QRS. What does QRS represent, right? QRS represents ventricular depolarization or ventricular contraction, right? Ventricular contraction. So what would you expect to see in the ventricle? And again, we're focusing here specifically on left. You could also focus on right, but we're just going to focus here on left. So what would you expect to see when you have the QRS complex? When you see ventricular contraction occurring, what would you expect to see in the pressure in the ventricle, right? Well, you would expect to see the pressure begin to increase, right? So notice here, as soon as you have this ventricular contraction, notice here, this purple line, you begin to have a sharp increase in the pressure, right? So ventricle begins to contract, pressure starts to go up, right? Notice here that the volume in the ventricle is the same, right? We haven't dropped off yet in our volume, right? Now, our ventricle is increasing in pressure, so meaning it's beginning to squeeze, it's beginning to squeeze, it's beginning to squeeze. And right here where this purple and red line meet, this is the aortic pressure. Right here, this is when our aortic valve opens, right? And again, this would also be true for the pulmonic valve if we are on the right side, right? So our aortic valve opens. What do you think is going to happen to the volume of blood in the ventricle, the left ventricle, when that aortic valve opens? As soon as that valve opens, blood is leaving. Blood is rushing out of the ventricle. So if you come down here and look at ventricular volume, you have a sharp drop in the volume, right? And again, that valve opens because of the increased pressure, right? The pressure in the left ventricle has now exceeded the pressure in the aorta, such that the aortic valve is able to open. The valve opens, blood rushes from high pressure to low pressure into the aorta, and the volume decreases, right? So the volume begins to drop, right? So it continues to contract, right, the ventricle. So the pressure in the aorta begins to increase as well because the blood is continuously flowing into the aorta. So again, the volume in the ventricle continues to drop until you get up to this peak, and then this matches up pretty closely with our T wave, right? So what does the T wave indicate? The T wave indicates and represents ventricular repolarization, right? So ventricular repolarization is ventricular relaxation, right? So our ventricles are relaxing, right? So when our ventricles are relaxing, what would you expect to happen to the pressure in the ventricles? Well, when the ventricles are relaxing, you'd expect the pressure to begin to decrease. So that's what we see. This purple line, again, the pressure is decreasing, right? At the same time, or at about the same time the ventricles are relaxing, we're having blood return into our atria, right? So blood is rushing into the atria, and then after you get to the end of ventricular relaxation, right? So again, this pressure is dropping in the ventricle. You get to the end of ventricular relaxation, you have your AV valves open, right? And so the blood that's been accumulating in the atria can now flow into the ventricle, and notice here the ventricular volume begins to increase again, right? So our volume in our atria in our ventricle, is increasing once we open those AV valves, right? So again, tricuspid and bicuspid valve, right? And then you can start the process over. Right? Now, one other thing I want to draw your attention to is this little notch right here, right? This is sometimes called the dicrotic notch. So what this is, you'll notice that, and this is representing aortic pressure, right? So this red line. You have pressure increase, again, as the ventricle is contracting, pumping blood into it. The aortic pressure increases. It begins to drop, again, as our ventricle is relaxing and the pressure in the ventricle drops. So what this represents is that blood is no longer flowing into the aorta. blood is falling back down. So some of the blood doesn't make it out of the aorta, and it falls via gravity. It starts falling back down. And the falling of that blood down in the aorta, the blood collects in the aortic valve cusps, and that forces the valve closed, right? So what you see here, this little notch, this sudden increase, the very short-lived but sudden increase in the aortic pressure, that's due to the blood being caught in those valve cusps, forcing the valves closed. You get a sharp increase, and then the aorta is closed off, and you get a drop in aortic pressure as you continue to have your decrease in ventricular pressure as well, right? And so again, you then have your AV valves open, ventricle continues to fill, and then the process continues, right? So those are the main things I want you to focus on. You could look here at the heart sounds. Again, this LUP here, this is S1, so this is your first heart sound. This has to do with the closure of your AV valves, right? So notice this sound here corresponds to AV valves closing. The DUP here, the S2 sound, this sound is caused by the closure of your semilunar valves. So closure of your aortic and your pulmonic valves, right? So consider those things. Last small thing here, you may have seen it, this indication here, stroke volume. So this is the max amount of blood you have in your ventricle. So that's your end diastolic volume. And this down here is your end systolic volume. And so the difference is the amount of blood that left during the contraction. And so that's your stroke volume, right? That's your stroke volume. So that blood that left here was rushing into the aorta, right, during ventricular contraction. And so that's why you see that increase in aortic pressure in red that corresponds with that decrease in ventricular pressure, right? Now, last short thing for this part is this idea of ventricular balance. So we talked a lot about, again, ventricular volume, ventricular pressure. Ventricular balance is the idea that the left and right sides of the heart, in terms of the volume and amount of blood that's being pumped, it's about the same. So roughly equal amounts of blood are pumped by left and right sides of the heart. Now, that's not to say that the left and right sides of the heart are identical, right? Because we know that they're not, right? If we look at the anatomy, we know that the left side of the heart is thicker, right? Because it has to pump against more resistance, against peripheral resistance going into the aorta, and the right side does not because it's pumping against or it's just sending blood to the lungs, and so there's much less resistance. But in terms of balance, they're pumping roughly the same. Now, if you have some type of heart failure, right, in which the ventricles are weakened and they have a decreased ability to move blood, then you can end up with something called edema, right? So swelling can occur. Depending on which side of the heart is weak, what side heart failure you have, you can end up with different types of symptoms, right? So if you have right-sided heart failure, so imagine the right ventricle is weak and it's unable to adequately eject blood, right? Where do you think you're going to see accumulation of blood and accumulation of fluid, right? Well, you would see it in a more upstream area from the right ventricle. So blood coming from the right ventricle came from where? It came from the right atrium, right? Blood coming from the right atrium came from where? Well, it came from the superior and inferior vena cava. And where did that bring it from? That brought it from the body. So it brought it from the upper limbs, the lower limbs, the head, the neck, things like that. So you would see swelling and edema occur in those areas, right? So you may see peripheral edema in the extremities. You can end up with something called JVD, or jugular venous distension, in the neck. Your jugular veins become very engorged with blood. If you have left-sided heart failure, right, if you have failure of the left ventricle, then you have the same thing, but upstream from the left ventricle. So left ventricle gets blood from the left atrium gets blood from the pulmonary veins are bringing blood from the lungs. So you can end up with pulmonary edema, right? So the accumulation of fluid in the lungs potentially making breathing more difficult, right? So this is where we'll stop. Again, consider this chart. Again, there's a lot going on, but go through it, look at each of the different phases independently, and then we'll pick up in our next part talking about something called cardiac output.